Welcome to another episode of the Empowered Fertility Podcast, the place where we dive deep into all things fertility. I'm Dr. Brenna Squires, a clinical psychologist and fertility support coach, here to bring you the knowledge, resources, and expert insights you need to feel confident along your journey to parenthood. So let's get started. Welcome back to another episode of the Empowered Fertility Podcast. Today, we are talking all about sleep, and I am so excited to have with us an expert in natural sleep medicine, Dr. Catherine Darley. She combines her knowledge of sleep and circadian disorders with her training as a neuropathic physician to bridge these two fields. She's treated patients for over 20 years, along with training healthcare providers in sleep medicine. Dr. Darley now focuses on teaching people the sleep skills they need to thrive at home, at work, and have high quality life. So welcome, Dr. Darley. I'm so excited to have you here today.
Thank you. I'm really happy to be here myself. This is an issue that's important to me personally.
Yeah, and let's get started with that. What got you interested in sleep in the first place?
You know, I've been interested actually since college, and it just, when the key fits the lock, it just felt like such an important issue that is foundational for our health. And it really touches everyone. Sleep is universal. And it's so fun to go out into the community and talk sleep because everybody has their sleep story, their own personal experiences, their wins, their challenges. And it's so just wonderful to hear people share that with me.
Yeah, and with that, do you mind sharing your sleep story and why this was really important for you to learn personally?
Yeah, well, I actually have had some problems with infertility myself. And one pregnancy, I had pregnancy-induced hypertension. So I needed to be a kind of on rest. I wasn't net strict bed rest, but I had to kind of cancel my projects and spend a lot of time lying on my left side. And, sleep is part of a good fertility plan. And I think that it's one of those pieces that can often get overlooked. We're so focused on diet and exercise and protocols that we may be going through. And I want to have this conversation so that sleep can be part of a person's comprehensive fertility plan.
Yes, that's absolutely right. We know how important sleep is. We hear it all over the place that sleep is so important. So, can you share more about why it's so important for us to get good sleep?
Well, I think about sleep in general for people, all people, in terms of 5 different areas that it helps us succeed. One is our performance, physical performance and cognitive performance. Both are going to be better when we are well rested. Then there is the health implications, mental health, anxiety, depression, those types of concerns, panic, PTSD, and then our physical health. And one of the things that's important when we're thinking about fertility is we want to have kind of we don't want to have a lot of inflammation. We want to have anti-inflammatory types of practices. And sleep is actually anti-inflammatory. So that's a kind of a first line basic, but many people have inflammatory conditions. Arthritis is an inflammatory condition, and it's going to be better when we're getting the sleep we need because we're going to be more in a low inflammation state rather than that high inflammation state. And then the last piece, which I think is so important and is really starting to get more attention in the sleep world, is our emotional intelligence and how well we're able to get along with other people. And, if you're struggling with infertility and working on plans with your partner or with your close community, you need to have emotional intelligence, both to support people and to ask for support and to understand different people's point of view. And, do the problem solving practice is going to be so much easier if you have good emotional intelligence and you're able to identify your own emotions and recognize the emotions in the people you're problem solving with.
Yes, those are really good things, good benefits, and why we would want to get better sleep. Can you share a little bit about the dynamics on how this impacts our body so much to be able to allow us to have better physical and cognitive health, better performance, better mental health? I mean, lower inflammation. All of that sounds great.
Right. Sleep is something that obviously is going on in our brain. Uh, and it also is going to shift our physiology in our body. We
Mm,
have kind of a sleep physiology and awake physiology, where
mm,
when we're awake, our blood pressure is higher, um, our heart rate is higher, our breathing rate is higher, our stress hormones are elevated, and sleep gives us the chance to rest from all of that. So if you
mm,
think about, somebody who needs 8 hours of sleep, which is kind of the average amount of sleep that we need, but they're only getting 6 hours,
right.
that means they're going to have another 2 hours a day with their blood pressure higher, their heart rate higher, and that causes strain on all of your organs.
Mm.
Having that extra time in this wake physiology, which is more demanding.
Yes, and that sounds stressful. Stressful for your body. It's if it's needing this time to turn off and to decompress to be able to allow everything to rest. Like you said, shift the physiology. It has more time. Could that cause diseases or long-term health problems?
Absolutely, absolutely. Um, a person that I was just working with yesterday is on my mind. I'll share. He is the sole provider for multiple generations in his household, and he works two full-time jobs. He works
Mm,
from 1 in the afternoon until 7 in the morning, 5 days a week, and he's having really significant heart issues. And, if you look at his schedule, he's only off from 7 in the morning till 1 in the afternoon, six
wow.
hours minus transportation time. Hopefully, maybe he's getting a meal, brushing his teeth. So he's only getting like 4 hours of sleep those 5 days a week. And I think, that's absolutely a risk factor for disease. I mean, that's a pretty extreme case, but yes, absolutely. We see in many different organ systems that when people aren't getting enough sleep or healthy sleep or right timed sleep, that they're going to be at increased risk of disease.
So those are three things that's interesting. Enough sleep, healthy sleep, or right time. So what is enough sleep?
That's a great question. And people may not like the answer. Enough sleep is somewhere between 7 to 9 hours for adults. And it's a bell curve. So that doesn't mean that all adults are going to be just fine so long as they're getting 7. It means that some people need 7, some people need 8, some people need 9. And what really matters is that you first identify how much sleep you do best with. We'll talk about that. And then you get that amount of sleep and design your lifestyle around that amount of sleep. And the
Mm,
reason that it's important to identify is because, the idea often people say, oh, well, if I get 7, that's in the range and I'll be
mhm,
fine. But I kind of think about how much sleep you need as equivalent to how tall you are. It's not something you choose, right? It's not something you can do much about, right?
sure.
And it's pretty stable throughout the lifespan. So, a
Mm,
good way to figure out how much sleep you do best with is to couple ways. Think back to a time when you were really well rested. How much sleep were you getting then? Maybe it was the last time you had time off, but you weren't
mm,
going on a extensive sightseeing trip or anything. It could be that on weekends you're sleeping longer. If you're sleeping longer on weekends, that is a sign that you're not getting enough sleep on work days.
mm,
The other thing to keep in mind is that if you're waking up to an alarm, you haven't gotten enough sleep. You're truncating your sleep, you're cutting it short. So, a great strategy for people who want to get more sleep, but they need to kind of shift their lifestyle is every 3 or 4 nights, increase your time in bed by 15 minutes. Just
mm,
keep increasing until the alarm goes off and you're already awake, or the alarm goes off and you feel like, okay, ready to go. That's really important.
And so would you increase it on the front end or in the back end?
That gets into that timing question. So I think
Okay.
if there's one thing that people take away from this conversation, I would hope that it would be those three things are the things that you need to check off. Am I
Yeah.
getting enough sleep? Am I getting quality sleep? In other words,
Yeah.
do I have a sleep disorder causing poor quality of sleep? Or
Yeah.
am I right timing it? The
Yeah.
timing is all about your circadian rhythm. And
Mm.
people have probably heard, morning owl, morning larks, night owls. We think human beings are basically a third in each of those chunks. A third of us are morning types, a third of us are evening types, and a third of us are neither, kind of middle of the road.
Mm.
And that gets back to your circadian system, which is this, excuse me, 24-hour pattern of physiological changes that help us be ready for whatever's coming next in our day.
Yeah.
Historically, as the sun goes down, it's getting closer to time to sleep. And so our physiology will start switching us into sleep physiology.
Mhm.
So, to answer your question, you should add the 15 minutes of time in bed um, in the portion of the night that you're more likely to sleep well. If you're a morning type and you're staying up late to get housework done after the kids go to bed, really common situation for families, maybe cutting that short and getting to bed 15 minutes earlier. Or on the other hand, if you're someone who likes to sleep in till 9 or 10 on the weekends and you're getting up a lot earlier, for work, maybe you can shift your schedule or your activities in the morning and allow another 15 in the morning.
Okay, that's good. That's good. And then with that, let's look over the third one, the health. How do we know about the health and quality of our sleep?
Yeah, so this is where I think about both our environment, our sleep environment. Is there something in our environment that's preventing us from sleep? That motion sensor light that's turning off and on outside our window, or something, any kind of environmental disturbance. Or is there something intrinsic, meaning, do we have a sleep disorder? And
Mm.
this is something that I wish everybody knew. I wish it was taught in those high school health classes, if they
Yeah.
even still have high school health classes. But there are 58 sleep disorders.
Wow. Oh my goodness. That's
Yeah.
a
So
lot.
who knew? Right? I mean, we probably can name off insomnia,
Mhm.
obstructive sleep apnea, restless legs,
Yeah.
and shift work
Wow.
or jet lag, right? But yeah, there's a lot more than that. And, sometimes I hear frustration from people that they've been reading up on sleep in magazines, they've been following people on social media, they've been implementing
Mm.
all of these strategies that they hear about in our public conversation about sleep, but they're just not getting results. They still
Yeah.
feel tired during the day. They're still not well rested, having symptoms in those five domains that I talked about. And I'd like to encourage people, if you've been doing all of the things that you hear about in terms of sleep hygiene and whatnot for 6 weeks, that's the time to go to a doctor and say, I've been working on my sleep and it's not helping. Can we evaluate whether I have a sleep disorder? Sometimes in insomnia research, we know people go with insomnia for 7 years before they ask a physician for help. And
Wow.
we want to cut that down.
Yes, and can you define insomnia a little bit for those people who don't really know what it is?
Sure. Insomnia is difficulty sleeping, and it can show up at any point in the night. It could be difficulty falling asleep at the beginning of the night,
Mm.
or you fall asleep and then you're awake in the middle of the night for a chunk of time. Or some people have what we call sleep maintenance insomnia, where they fall asleep, they sleep for 4 or 5, 6 hours, they wake up, they know they haven't gotten enough sleep, but they're just not able to fall back to sleep for those last couple hours.
Hmm. So trouble falling asleep, and then when you said they're waking up and staying awake, is this like someone who will wake up around 1 to 2 o'clock, stay awake for about an hour or 2, and then fall back asleep?
Yes, that would be insomnia. And it can
Okay.
be, sometimes people say it's only half an hour. Some people have like a 2 hours of being awake, very frustrated,
Mhm.
unhappy, being awake at that time of night.
Yes, and then the third one you said is if they fall asleep, they have no trouble falling asleep, but they wake up super, let's say, super early, or they only had
Mhm.
about 5 hours of sleep and they can't get back to sleep.
Right. Yeah. Mhm.
Okay, and then that would also be insomnia, and if they've been experiencing that either daily or most days for 6 weeks, you say?
We consider insomnia to be 3 nights a week for
Okay.
3 months or more is
Wow.
considered chronic insomnia. And what I see, Dr. Brenna, is that people will have some kind of event happen in their life.
Hmm,
They have a job change, they move, the kids start school for the first time. There's some kind of life event that happens. And their sleep's disturbed because it's a
yeah.
change, it's thought provoking, maybe their schedules changed, different relationships with new coworkers, whatnot. And they think, well, of course I'm not sleeping well because I had this change. But then after months, they've accustomed to the new change,
Hmm.
but their sleep is still disrupted. So I really encourage people, if you are going through some kind of life event, you still want your sleep to be on track and you still want to work on it and not just kind of accept that your sleep's going to be poor because that can set you up for longer term problems.
Yes, thank you for sharing that because I know some people will think that where they'll say, "Oh, it's just a life adjustment, and that's the problem." But what
Mhm.
happens if there's multiple life adjustments and they still can't get back on track because there's just so many adjustments at one time?
Right, exactly. And the thing that people may not know is that every time you have acute insomnia, we think of insomnia as acute or chronic. Acute would be less than 3 months, maybe less
Okay.
than 3 nights a week. But every time we have an acute insomnia episode, it increases our risk for developing chronic insomnia. So you really
Mm,
want to be proactive and kind of nip it in the bud. I know that's hard, right? I've certainly had times myself where things are changing, a move or whatnot, and
yeah.
sleep is not as good. But in even with all the change, it's good to prioritize your sleep as best you can.
Yes, absolutely. And so before we go into the how-to things, I'm curious about other risk factors. So you listed a couple of risk factors with your work schedule as well as life transitions. Are there any other risk factors for poor sleep?
Yeah, so I'd like to kind of talk about those 58 sleep disorders. The
Yes.
reason that I bring that up is that uh, we could all be at risk for having any of these, and even the rare ones,
Hmm.
people do experience them. So it is possible that you have a sleep disorder that is not as common, but still needs to be addressed. And that's the why it's good to eventually go to a physician who can fully screen you for sleep disorders, because there's obstructive sleep apnea, which when I first started in sleep medicine, we kind of characterize it as an older, overweight man's disease. But now we know that people of all body types, genders, ages can have obstructive sleep apnea. That's where the airway, just at the back of the throat, just right here, actually collapses and obstructs for 10 seconds or longer. The diaphragm is still pumping, the brain is still saying to breathe, but no air can get through this airway that's collapsed. So blood pressure goes up, heart rate goes up, and stress hormones are released. At some point, the blood oxygen level starts to drop. The body says, alarm, time to wake up. And the person will wake up for 5 seconds, 10 seconds, just long enough for the airway to pop open and they can
Hmm.
take some breaths. So, if you're struggling with fertility, it may be worthwhile for all the parties involved to get tested or at least screened with a visit to the doctor for these types of sleep disorders, because there are many and they're much more common than we previously realized.
Yes, and can you share a little bit more about how poor sleep, even acute, can impact fertility?
Yeah, so there's a lot of good research emerging on this area. One of the things that we need to think about first is just simply sleep amount, how much sleep you're getting, because the research shows that both for men, fertility, male fertility and female fertility, it drops significantly when people are getting less than 6 hours.
Hmm.
To put it in perspective, it's probably only 2 to 3% of the population who truly are fine and only need 6 hours. They would kind of be outliers on the short end of the sleep needs spectrum. But 35% of people are getting only 6 hours. So we have this disconnect. Much more people are having only 6 hours than actually do okay with it. So with men, less than 6 hours of sleep is translates into lower sperm count.
Wow.
That's obviously an important factor for fertility.
Mhm.
For women, I'm looking at my notes so I get the numbers exactly right.
Yeah.
In women, when they're getting less than 6 hours of sleep, we see a 20% decrease in conception rates compared to women who are getting 7 to 8 hours. So that's a really
Wow.
significant, one in your chances drop 20% if you're only
Yeah.
getting 6 hours of sleep. For shift workers, we also see a decrease in fertility. Shift work is when you're working or commuting to work at a time that you would normally otherwise be sleeping. So that also is a good definition to keep in mind because it's personalized for someone who's a night owl getting off work at 10 p.m. From a restaurant and getting home and into being able to get to bed by midnight or one may not be shift work really because it's not interfering with their typical natural sleep hours. For someone who's a morning type and likes to go to bed at 9, working at a restaurant till 10 or 11 is going to interfere with their sleep. So keep that in mind. You really want to personalize what's shift work, but it's about 20% of Americans who do shift work. And of course, there's some industries that are more prominent shift work like healthcare, transportation, some branches of manufacturing where they're operating 24/7.
Yes, and that kind of goes with something that you had said early on with design your lifestyle around your sleep because everybody is different.
Yes. Yes.
Yeah.
And one of my colleagues made this analogy that I just love, and I'm going to use that we wouldn't um, restrict eat our meals and only eat 80% of the food that we need for 5 days a week and then think, oh, I'll just have a feast on the weekend. That doesn't work. You need to have adequate sleep every night
Yeah.
and try to have a lifestyle that
Yeah.
allows enough sleep on the work nights. And I know, we have hustle culture now. Everybody has their job and a side gig, right? And as much as you can, try to step away from that in
Yeah.
terms of giving yourself the sleep that you need to enjoy your life and to be successful. I think
Yeah.
part of the thing about hustle culture is trying to be successful, trying to afford the vacations and so sometimes afford just the rent, right? Depending where you live.
Yeah.
But if you're not getting enough rest, you're not going to be able to perform as
Yeah.
well in terms of your cognitive function, your physical stamina, and it's really going to impact your quality of
Yeah.
life if you're not getting enough rest. And so,
Yeah.
one thing when people say, well, I'm only getting 6 hours, but I just don't see how I can increase that, is to kind of look at how you're spending your time. Like, you know, I scroll on my phone. Does it add value to my life? No. And so I try as much as possible to like put the phone down and choose to do something that adds more value to my life. And when I was a single mom and my daughter was in the house, I wanted to get enough sleep. And honestly, there's a few things that I had to decide, like, I'm just not doing it. Like,
Yeah.
I kind of let my standards go down for my garden because
Yeah.
I was just like, my sleep, my health, my relaxation is more important. I have friends who, went from using porcelain dishes to using paper plates. Like they just were like, I just need to cut some corners here and we're just
Yeah,
going to use paper and I'm just going to like enjoy that extra 15 minutes, 30 minutes of dishwashing every day. That those
yeah,
little minutes add up,
they
right?
do.
So, as much as you can kind of push away the standard of having the perfect house, the perfect,
Yes.
garden, the perfect whatever, and prioritize some downtime, some sleep.
Yes, and that it goes into what you just said, priorities. What are your priorities? And too many times we we mislabel what our needs actually are. And like you just gave that really good example of we know we need to eat in order to function well. And we know that we need to sleep, but sometimes we don't really see it as a priority as much as success or achievement or making money. And so I've seen in many people's careers that they will eventually hit burnout if they don't prioritize those things, if they don't prioritize rest, if they don't prioritize proper nutrition and they're just running, running, running. Eventually they're going to hit empty and just crash.
Yeah, absolutely. And um, one of the things that happens with sleep deprivation, which is really interesting, and it's
Mm.
kind of similar to drinking alcohol, is that people lose awareness of how impaired they are. Like, if you,
Oh,
after just 3 nights of getting only 6 hours, the first couple days you might go, oh my goodness, this is really affecting me. But after the third night, what happens is people say, oh, I think I got used to it. I think I can handle this now. And what we know from testing and cognitive testing and performance testing is that their performance is still on the downward slide,
wow.
but just their assessment of it. And I think about it like, after the second drink, you might think, I should probably stop now. But if you keep drinking and have that third, fourth drink, you're like, oh, I'm fine. Everything shifts
Yes.
cognitively in kind of your assessment, your ability to assess how you're doing.
Yes,
So,
that's interesting. No,
yeah.
go ahead.
No, go ahead.
No, I was just gonna say that's interesting because when they go to have testing, some of the questions are probably subjective to say, "Well, how do you feel like you're doing?" And with based off of what you're saying, if they lose awareness, they could say, "Oh, I'm having 6 to 7 hours of sleep, and it's not that bad." But what you're
Yes,
saying
exactly.
is they may think it's not that bad because they've been used to it. They've been used to operating at a lower level.
Exactly. It's like that new normal is the new baseline of performance has shifted.
Wow.
Exactly. That's exactly right. Yeah. So, one strategy that I encourage people to take to kind of reconnect with how good they
Mm.
could feel, how good they could perform, is what I call the 10 by 10 test, where
Mm.
for 10 nights in a row, you give yourself 10 hours in bed. That may seem like a lot, but
Yes.
when people do that, and studies have shown this, often people will sleep the entire 10 hours for the first nights, and
Mm.
then it'll decline to closer to what they need on a regular basis. But it can really help you kind of recalibrate what could my emotional intelligence and emotional regulation be like if I was well rested. And people can keep track of any symptoms, so those symptoms in the 5 domains, maybe, okay, I'm short tempered with some people, I don't want to be, but I am, do an assessment or in those areas: cognitive function, physical function, um, physical health, mental health, emotional intelligence. See, identify any weak areas, then do the 10 by 10 test, and then check back in. Is this better? Am I doing a better job regulating my emotions, being pleasant, being present, all the things that I want to be? um, to do the 10 by 10 test, you want it to be um, one stretch, and you want the hours to be as consistent as possible across the 10 days so that
Okay.
you can really kind of synchronize your circadian rhythm also. And this would not be a strategy for someone who has insomnia. This would be a strategy for someone who is getting not enough sleep, and they just need to figure out how much sleep they do best with and kind of recalibrate how good they could feel, how good they could perform.
Okay, I'm glad you made that distinction because I was going to ask, what if someone tries that and they're sitting there for about an hour or two?
Yeah, that would not then the 10 by 10 test wouldn't be the thing. For someone who has insomnia, it's not. For somebody who has this chronic sleep deprivation,
Mm,
that would be a good um, practice to try. And
okay, so
obviously, to do that, you have to talk with other people in your household. You may have to rearrange some things and plan it out in advance.
yeah. So this would be someone who has, let's say, 6 to 7 hours, but they may do better with, let's say, 7 to 8 or 9, and they're just trying to lengthen the time. Is that correct?
Yes, exactly. That's
Okay.
exactly right.
Okay. So this is a good strategy if you're trying to lengthen it, but not if you're already struggling.
Exactly.
Okay.
Good
Good.
clarification.
Yeah, good to know because I was thinking, "Oh my goodness, if you're already struggling to sleep, that sounds like a terrible test."
Oh, it would be, yes, absolutely the wrong direction to go.
And so let's talk a little bit about testing. What does testing look like for someone who thinks that they may struggle with a sleep disorder?
Yeah, so the first thing to do is to talk to your physician. We kind of have steps, right? That first thing to do is that screening interview where you're talking with your physician saying, these are my symptoms. I'm wondering if I might have a sleep disorder. Can we screen? And they'll ask you questions about those different there's 6 different categories of sleep disorder. So they'll touch on those. They'll ask you about your family history. Like, I mentioned that obstructive sleep apnea is all about the airway. And just like we look like our parents on the outside, we can have the airway like our parents. So if you have a sibling or a parent who has obstructive sleep apnea, you are at increased risk. So they'll ask about family history. Insomnia risk also increases in families, restless legs. Symptoms also increase in families. So they'll ask about that. And then they may refer you to a sleep center if they have a positive finding, or they may just directly refer you for a overnight sleep study. These can be done at home. They can also be done in a sleep center where you go in and you sleep overnight and they observe your sleep. So that's kind of the course that people can anticipate. And, all the different sleep disorders can be treated. So feel encouraged about that. You're not going to get information that then you're like, okay, well, we know this, but what do we do? There are
Yeah.
definitely well established treatments for all the different sleep disorders.
That's good to know, especially since there are so many. It's good to know that there are treatments that can help.
Yeah,
with
absolutely.
with the testing, what's the difference between at home and in a sleep center?
Yeah, so the home sleep tests are really specific for people who have obstructive sleep apnea. It's not going to find other categories of sleep disorders. And we use those when we're really pretty sure that the person has obstructive sleep apnea. They're less sensitive equipment, so
Mm,
they're not right for people who have we suspect have mild sleep apnea because they're just not
mm.
sensitive enough to pick it up. But if we think, yeah, it's pretty clear that this person has obstructive sleep apnea, moderate to severe apnea, then we will do the home test.
Okay. That's good because then that means everything else is you're going inside a center.
Yes. Yes. And there's some categories of sleep disorders that we don't need to do a test. Like for
Oh,
insomnia, we don't need to do a test. That is really diagnosed based on their history, a person's
okay.
history. The whole category of almost all circadian rhythm disorders, which would be shift work, jet lag, those kinds of disorders, we don't need to do a overnight sleep
Okay.
test study. It's really for sleep breathing disorders, some of the sleep movement disorders, and then some of our rare conditions like narcolepsy that we would do the in lab study. So, most sleep disorders, actually, you don't need that. And,
Nice.
if you sometimes I hear from people that they're uncertain what to expect if they had to do an overnight sleep study
Yeah.
and they're nervous about that, and it
Uh-huh.
can sometimes kind of prohibit them from pursuing this. I want to reassure people that if you do need an overnight sleep study, you will have a bedroom to yourself. It's not like you're going to be in a hospital ward where there's other people in the room. You will have your own bathroom. So it's kind you have your own suite basically. So you go in, you have your own suite. It is secure. You'll just be working with probably two staff over the 12, not 12, 10 hours that you're there at the sleep lab. Um, and so hopefully people can feel a little bit more comfortable. You can bring your pillow and your blanket so that you've got the setup that you're used to. And it's really, the staff always works their hardest to make you as comfortable as possible so you can get a good night's rest.
Yes. Awesome. Thank you so much for sharing that because that was going to be my next question. What can we expect? Because I'd be a little nervous because I wouldn't know what to think, and I know many listeners are probably thinking, "I don't want to do that. What's going to happen?" So thank you
Right.
for sharing that.
You're
Awesome. And
welcome. I
then
wanted to mention about IVF
yes.
because there is some, we didn't talk about that, but there is some um, research showing that when people are not sleeping well, not enough sleep, or they have a sleep disorder, they're actually lower IVF success rates. And,
Wow.
that takes so much resources for a family to go through IVF. It's expensive. It takes a lot of energy to do the protocols and whatnot. And we just want you to be as successful as possible. And there's
Yes.
actually lower, poor implantation,
Mm.
and that's why lower IVF rates when people have sleep problems going on. So if you're pursuing IVF, think about your sleep and get the guidance that you need to make sure everything's okie dokie with that.
Wow, that's super important because like you just said with we were thinking about natural fertility and how that can negatively impact the sperm quality and just overall health, but now you're saying even if you do IVF, that implantation it's less successful if you're having poor sleep.
Exactly. Yeah.
Wow. Let's go into some of the how to's. How can we fix some of these things? And I was thinking about the categories with enough sleep, healthy quality, and timing. I don't know if we can go a little bit more into those areas with the how to, but how can we get enough sleep?
Yeah. So we talked already about the 10 by 10 test
Yeah.
and the other strategy of just increasing your time in bed 15
Hmm.
minutes every 3 or 4 nights,
Hmm.
and thinking about your priorities. When we want to expand our sleep time, that means we have to shrink what we're doing and expecting of ourselves with our wake time, right? Because if you're
Yeah.
only getting 6 hours of sleep, that means you've got 18 hours to do stuff. And if you want to increase that to
Yeah.
8 hours of sleep, that means you're going to only have 16 hours of time to do stuff. And you need to kind of purposefully shrink that,
Right.
go. I mean, if you're on your phone a lot or watching TV or gaming or whatnot, maybe you can pretty easily set those things aside.
Yeah.
Or some of those tasks that you're doing may be harder to, you have a household routine.
Mhm.
So many families I know, they're doing housework after the kids go to bed. And so that might be more difficult choices to shrink your evening routine so you can allow more sleep time.
Yeah.
So that's the first thing, is the sleep quantity.
Mhm.
The next piece is the sleep quality, getting
Yeah.
those sleep disorders addressed, and then also really tuning up your bedroom. I'd have to say that when I started working with patients, it was one of the most surprising things for me how many people have something that they know bothers them in their bedroom, but they haven't yet addressed it. I
Huh.
think we all have kind of perpetual tasks that are on our to-do list that we just don't get to. And I
Yeah.
encourage you, if you have something in your bedroom that disturbs your sleep, move that to the top of your priority list.
Yeah.
This weekend, take half an hour to do a bedroom review and be like, is it dark enough? No, there's a annoying LED light on that electronic device, tape over those things or do whatever you need to do, get blackout shades. We really want our bedrooms to be dark. It should
Yeah.
be so dark that if you hold your hand out at arm's distance, you can't see your fingers wiggling. That is
Oh,
how
wow.
dark it needs to be. Think about, how dark would it be if there was no electricity in my town? That's how dark you want it to be in your bedroom at night when you're sleeping. The next thing is to make sure that it's quiet. That's not something we always have control over. Maybe we live near a loud freeway or airport or neighbors or something. Maybe you've got kids of different ages up at different times in your household. You can use a fan or a white noise machine or earplugs. Actually, the pediatric size earplugs are more comfortable for people of all sizes. To wear long term if you need to wear earplugs. You want your mattress to be comfortable. What I prefer in terms of the firmness is probably different than other people. So just, get a mattress that is comfortable for you as best you can. And then a really important piece that people often aren't aware of is it needs to be cool. Think about how before electric light or before electricity in our homes, when the night approached and we went to bed, it would get cooler in our homes, and we need it to get cooler in our homes. We sleep better, usually less than 65 degrees. Of course, for people who are living in really warm climates, 65 might be too cool. You want it, though, to be cooling down and cool at night. People, that definitely helps our circadian rhythm. The last piece, which really impacts sleep, is our circadian rhythm. And this is an area that people often don't really know about. Um, like I said, it's this 24-hour variability in our physiology that helps us kind of physiologically prepare for the next stage, whether it's sleeping at night or being awake during the day. And this has a huge impact on our health and on our sleep.
Yes. Thank you so much for sharing that list. I was taking notes as you were speaking
Oh.
just so I can do, like you said, your little checklist. So over the weekend, we can do that little checklist like you said. But two things stood out to me that I was curious about. There's this big thing about not just having the right mattress, but having the right pillow. How important is it to have the right pillow?
It is important, actually. There's a couple things about pillows. One is they are hard to clean.
Mm,
And so you want to replace your pillow every 2 years.
mm.
Sometimes people tell me, "Oh, but I have the pillow that I got in college." And no, don't use the pillow that you got in college. Um, this is the gross. I'll go with the gross answer. Um, Dust mites can live in pillows. Dust mite populations start to live in pillows, and you may know older pillows get heavier, and because of dust mite poop. Like dust mite poop builds up in the pillows,
Yuck.
and that's why if you have some really old pillows, they are likely to feel heavier than new pillows, and that is why.
Yuck.
So every 2 years. And one strategy I use, I just put, whenever I get a pillow or a mattress, I put the date on it. And I just know every time I'm changing the linens, I see that date and I go, oh, yeah, a year to go. Or gosh, I need to get a new pillow and throw this one out. So that's the other thing about pillows is that it needs to be right for you, whatever your sleeping position is. We prefer that people not sleep on their stomach because your neck is going to be cranked too much to the side. Uh, Good sleeping positions are mostly on your side. Sleeping on your back can make obstructive sleep apnea worse.
Mm.
So when you are sleeping on your side, you want to have a pillow that is this wide. Keep your neck in neutral alignment, and then the width from the outside of your shoulder to your ear, that's how tall your pillow should be. So probably everybody in the household needs a pillow that's a little pardon me, a little bit different thickness.
And and with that, let's say you have a softer mattress and your body kind of sinks. Does that matter? Like, where do you measure? Do you measure with the width while you're awake and standing up, or do you measure while you're laying down from the mattress to your head?
Yeah, while you're laying down would be ideal.
O
And basically, when we're sleeping, we want to have neutral spinal alignment. That's
okay.
where our spine from our head down to our tailbone is just in a straight line and nothing's twisted too much. So, when you're side sleeping, another good practice is to have a pillow between your knees
Okay.
and your feet so that you are keeping your lower back in a neutral spinal alignment and not twisting too much. And then, of course, for pregnant women, having those body pillows, particularly as the belly grows, having a body pillow that you could sleep on your side, you could have it under your arm, support your upper arm. You could have it under the belly and kind of support the belly. You could have it between the knees to support hip alignment, particularly as birth approaches. We've got relaxin, which is going to relax the ligaments and having our hip in neutral alignment and supported is going to be even more important as those changes come on.
Yes, and I just want to clarify something that you just said. Did you say you need a pillow between your knees and your feet?
Yeah, you want the pillow to be, instead of up by your thighs, you want the pillow to be between your knees and towards your feet so that
Okay.
just your limb is supported and not twisting at that lower limb.
Okay. And is there a measurement that we should be looking for with regards to that, or
Uh,
it's just whatever it feels supported?
yeah, whatever's going to feel supported.
Okay. What about those pillows? And I know I'm on pillows because that's something that I've been thinking about recently. What about the pillows that kind of curve to your neck and then have a kind of like an indenture for your head?
Uh-huh. Those ones, actually, there's some that are designed actually for your knees that have that shape, like an hourglass kind of shape is what you're
Yeah.
talking about.
Well, no, I'm talking about
Um,
for the head. So for the
Over the
head,
head.
maybe that's for back sleepers, but it's a
They
regular
are for
pillow, and
backs.
then the center is flat, and then there's cervical.
Yeah, those are for back sleepers, and the
Okay.
idea is that the roll kind of supports this curve that we have at the back of our neck, the
Okay.
cervical, curve there.
And so that's not something that you need if you're a side sleeper having extra
No.
support here.
Right. And
Oh,
with for back sleepers, you don't wanna be sleeping with a really big pillow behind, the back of your head where you're sleeping with your chin like this.
yeah.
You know, that's gonna compress your airway. You
Yeah.
want to have a very slim or no pillow or that kind of, cervical roll,
Mm.
support that you're mentioning.
Okay, yeah, that's good. And then you said for the leg, you do want that indenture for the knee
Yeah,
area.
they have little, knee pillows, they're called.
Okay. Awesome. And so do you have any tips for someone who is struggling to fall asleep? Any aside from
Yes.
doing everything that you just said, which is awesome. Any other tips
Yes,
for falling
so
asleep?
the biggest thing that people may not know is that our lighting exposure for the 2 hours before bed really, really matters. There's not words to express how much it matters what kind of light you get at night.
Huh.
For the 2 hours before bed, you should be getting light that looks like sunset. So we all
Hmm.
kind of know what sunset light is. It's more yellowish, reddish, pink. You know, shadows are long, it's dimmer. You want to recreate that in your environment as best you can. One and it needs to be dim. So one thing that tool I love is on your smartphone, you can download a free Lux Meter app, and for the 2 hours before bed, it should be 10 lux or less.
Hmm.
To give perspective, one lux is equal to one candle flame from 3 feet away. So 10
Mm.
lux is not very much light. And that's what people historically, until electric light was so ubiquitous, we just didn't have good lighting at night. And what happens when the sun starts setting is our eye perceives that change and signals to our brain night is approaching. And then we release melatonin from the brain. First, it goes around the brain, makes us drowsy. And then it goes into the body and it tells every cell nighttime is approaching.
Mm.
Excuse me. Nighttime is approaching, time to switch into nighttime physiology.
Mm.
And that nighttime physiology helps us sleep. Right now, when we have the lights on in our home, we're getting blue light from our
Mm.
computers. Blue light is much more prevalent in morning sunlight.
Mm.
And blue light tells our brain it's time to wake up. So you want to have 10 lux of kind of yellowish, reddish light for the 2 hours before bed. That might seem like it's not enough. I mean, for many people, they're still in a really active part of their day
Mhm.
in those 2 hours before bed, getting stuff
Yeah.
done, ordering things for the family. You can wear what are called blue blocking glasses,
Mm.
and that makes a huge difference. Even people with insomnia, a week or two of wearing the blue blockers definitely improves their sleep. So I
Nice.
think basically everybody needs to have blue blockers. And then the other thing you can do, you can see behind me this little string of kind of yellowish lights.
Mhm.
Those are our nighttime lights. So in my home, any room that we're going to be in for those 2 hours before bed, I have some kind of lighting that we use in those 2 hours that meets the criteria. So this room we use as our rec room at night, and I have this light, and we just turn off all other lights and have these twinkle lights, and it gives us 10 lux or less, and it's the right color spectrum, and it kind of tells our brain it's sunset, time to get sleepy.
Yeah, what a great idea. I like that idea of just setting it up in those rooms that you're gonna be at, and it's already ready for you.
Exactly. Yeah. Like my kitchen, I don't want to be in the kitchen in the 2 hours before bed, and I didn't change the lighting in there. I didn't add anything. So having lights like these, or
Yeah.
another strategy in other rooms, I have some standing lamps, but the lamp's shade aims up. So there's never ever any direct light. And in those lights, I've put dim, yellow hued, older
Mm.
incandescent style lights. The modern LED full spectrum lights suppress 80% of our melatonin. So, of course, we're
Oh,
not
wow.
sleepy. Yeah. In the naturalistic light conditions, which would be sunset, firelight, candlelight, people's melatonin starts to rise about 2 hours before bed. And so they feel very sleepy by the time they get into bed. And for modern people with LED lights, your melatonin often can't start to rise until you get into bed and turn out the lights. So of course it takes longer to fall asleep.
Wow, that makes sense, and so with this strategy, you're really basically like you said, you're telling yourself, "I'm going to bed soon, so start preparing my melatonin and
Yeah,
start the process so that by the time I get in bed, I'm actually ready to go to sleep."
exactly. Yeah.
Awesome. So, I I'm wondering about the other people who are struggling to either stay asleep and they wake up during the night or they wake up early. Do you have any tips for those people to either stay asleep throughout the night or if they wake up early how they can either fall back asleep or any tips for either of those categories?
The the light suggestions will actually help people who are waking up in the middle of the night or in the morning,
Nice.
because their total melatonin release will be higher and longer
Mm.
if you get good proper darkness.
Mhm.
uh, the other strategy is you don't want, one of the things that we use for treating insomnia which is actually the recommended treatment, is called cognitive behavioral therapy for insomnia. It is a series of usually about 6 appointments. There's different protocols that you do to kind of relearn how to sleep. And this is specifically for people who have insomnia. You can find someone who does cognitive behavioral therapy at behavioralsleep.org. There's a provider tab that you can find people anywhere in the world actually who have this skill to do this protocol. It is very effective. It's
Hmm.
recommended more than medications for insomnia, actually.
Oh, cool.
One of the things that people who have insomnia struggle with is that we have people may have heard of Pavlovian responses where we're trained to have a certain behavioral response to different situations. And once you have spent hours, many could be hundreds of hours, awake in bed when you don't want to be awake, frustrated, feeling the emotions, maybe worrying about why am I awake? What's wrong
Yeah.
with me? And all of those things that those thoughts that arise when we're awake in bed and we don't want to be, then you can start to have a Pavlovian response of
Hmm.
my bed is someplace to be awake and upset.
Oh,
And
no.
that is obviously going to interfere with sleep. So we have to get help with a behavioral sleep specialist to unravel that association that's developed.
Wow. And yes, and that makes sense if you develop this response pattern to the bed because of your past experiences. I like that strategy of using the CBT approach specifically to address those concerns.
Yes. And, often people who have insomnia, they'll say, gosh, I go on vacation or I go visit my mom and I'm sleeping
Yeah.
on the crappy hide a bed and I sleep better. Like, how can I possibly sleep
Yeah.
better when I'm in the rec room on this horrible bed in a
Yeah.
new place? But I do. And then, or they'll say, I fall asleep fine on the sofa. Like, if I sleep on the sofa, I'm fine. I sleep through the night. It's my
Yeah.
bed that is a red flag.
Yeah, I mean, I've also heard that that's why it's important not to do a lot of activities in the bedroom, like watching TV and playing games and doing things because it sets the room up to be something other than rest.
Right. Yeah, that's absolutely. We want to save the bed, the bedroom just for sleep and sex. And that's
Yeah,
it. That's all
that's
that
it.
that's it. Yeah.
Yeah.
And, sometimes people need to use their bedroom as a space for a workable space, right? Particularly
Mhm.
maybe teens or college students or people who are living in a studio apartment or just otherwise compressed space. And if that's the case, still do something to separate the bed as its own space from the rest of the room
Mm.
that you need to use for work or hobbies or whatnot.
Yeah.
You can get one of those folding screens and put it around your bed. A cheap hack that works well and you can make it look nice is to kind of put curtains around your bed or enclose your bed. An easy thing to do, this is great for college students or studios, is to find some kind of decorative fabric. Could be a nice old tablecloth from the Goodwill, whatever it is, and just pin it to the ceiling around your bed and kind of just make curtains and be like, okay, the bed is this own distinct space. It's for
Yeah.
sleeping. The rest of the room we're using for life.
That's great because, like you said, we're trying to condition our brain and our body to know what to do in those specific spots.
Exactly.
Awesome. And I know I'm going to get this question afterwards, so I'm figuring I'm going to ask it. What are your thoughts on supplements? Supplements to help with sleep.
Yeah, I think there's a broad range of supplements that I use in my practice with people. If you're going to use supplements, I would definitely go to somebody, a naturopathic physician or holistic integrative medicine physician who has training and can
Mm.
help you pinpoint because there's 20 supplements I could name off the top of my head, but they're not right for everyone. And particularly if you're on the fertility journey and you're maybe doing other protocols, you just want to make sure that what you're choosing is
Yeah.
appropriate for your overall health objectives and whatnot.
Yes.
So, yeah, herbs, nutrients definitely impact sleep because they impact our biochemistry.
Yeah. Excellent answer. We're basically tailoring it to you. And so we don't want to just take any supplement because someone said that it could be helpful, because it might be helpful for one person, but it's not helpful for you.
Right. And I wanted to make some comments specifically about melatonin.
Mhm.
Melatonin is widely misunderstood.
Mm.
There's many factors in getting the right melatonin, and so sometimes I hear from people, "Oh, I tried melatonin and it didn't work," but we need a lot more information to get the right dose. It's the dose in terms of, is it a low dose, a physiological dose, or is it a high pharmaceutical dose? We need to know what formula. Is it time release? Is it immediate release? Is it sustained release? We need to know the source. Was it made in a factory from petrochemicals, or was it extracted from plants? We need to know the quality of the brand. There was a couple concerning studies, and this is why I bring it up, where the researchers took a bunch of brands of melatonin just off the shelf of a grocery store and they tested them. They found some of the melatonin had only 20% of the amount that it said on the label. Other melatonin had
Wow.
five times as much melatonin as it said on the label,
Oh my word.
and some of the melatonin had contaminants in it. So I'm a strong proponent of plant-based melatonin, which you can find on the internet, and just getting the right dose. There's no indication that higher doses, doses higher than 3 milligrams, actually work better for sleep. And then there's the timing. Are you taking it 6 hours, 1 hour, 30 minutes at bedtime? All of those things matter. So if you want to take melatonin, I'd also go to a sleep specialist to figure out what is the right time and dose and all of those things I just talked about.
Yeah.
It's widely misunderstood product.
I mean, just hearing what you just said, with there's one melatonin could be 20% less, or one of them has 5 times more, one has contaminants. I mean, just hearing that makes me feel a little stressed, thinking, how am I supposed to know, just looking at the shelf, which one's gonna be good?
Right. Yeah. It's kind of a cart before the horse, where corporations are making profits from the
Mm,
melatonin, but people don't really know how to use it. And
yeah.
so that's unfortunate.
Yeah, all more reason, going back to what you said a few minutes ago, all more it's why it's so important that you need to have a health professional to do this with you, because we need to make sure it's working for you and your body and your sleep style and your lifestyle.
Exactly. Yeah.
Yes. Well, this has been so enlightening. I thought I knew a lot about sleep, but I've learned so much. So thank you so much for sharing all of this information. And before we go, I want to see if you have any final thoughts for our listeners.
Yeah, I would really encourage everyone to take 10 days to really optimize your sleep and just kind of make it a project. You know, do the bedroom review. And Dr. Brenna, I have actually a bedroom review kind of checklist that I'm happy to share with you. I don't
Yeah.
usually, it's not usually what I share with audiences, but I think since it's come up and it was so, interesting to talk about and
Mhm.
such a foundational piece, I can share that with you, your listeners. So
Yes.
take 10 days to do the bedroom review, optimize your sleep as best you can, and really see how much it pays off, because I think it will likely pay off more than you suspect.
Yes, awesome. Thank you so much, and thank you for sharing your checklist. I'm excited. I was writing notes, but now that you're going to share a checklist, it can be so much easier for us to print out and just literally check.
Wonderful.
And if somebody wants to work with you or learn a little bit more about your style and your approach, how can they connect with you?
Yeah, so I'm on social media at Skilled Sleeper, YouTube, Instagram, Facebook, Substack, and you can take a course from me. I have courses that are designed specifically for different demographics, which is kind of unique from online sleep courses. I have one that's specifically for women across the lifespan. I have one that's specifically for families, and then other demographics, athletes, shift workers, whatnot. So you can find those at skilledsleeper.com.
Awesome. And I'll include the link in the show notes as well. So thank you so much for sharing that. And thank you so much for sharing all of your knowledge about sleep and being open to be able to give the checklist to our listeners. I appreciate that. And I know they appreciate that as well.
You're welcome. Sleep well, everyone.
And thank you so much, listeners. I hope you've enjoyed this episode. If you have any questions, feel free to put it in the comment section. And if you have ideas for other episodes, also put that in the comment section. And I'm excited to see you in the next episode. Take care. Thank you so much for joining me today on the Empowered Fertility Podcast. If you're looking for personalized support on your journey, whether that's through therapy or coaching, please reach out. Just complete the contact form linked in the show notes, and someone from my team will be in touch with next steps. Remember, you are not alone. You are not broken, and your story is not over. See you in the next episode.